Hello, and welcome to our journey into the fascinating and crucial field of public health. Before we roll up our sleeves and unpack definitions, theories, and frameworks, I want you to take a moment to imagine this. You're walking through a bustling city. On one corner, you see a group of children getting vaccinated at a community health center. A little further down, a sanitation worker is ensuring clean water flows through the pipes. In the distance, a billboard reminds people to wash their hands and wear masks during flu season. These are all public health in action. Public health is not just something we read about in textbooks, it's an active, living system, an ongoing effort to protect and improve the health of entire communities. It's as much about preventing problems as it is about responding to them. In this module, we'll explore the foundations of public health, where it came from, what it does, the tools it uses, and the social forces that shape it. By the end, you'll see that public health is not simply about hospitals and doctors, but about systems, environments, and the very structures that allow people to live long, healthy lives. 2. What is public health? Let's start with a clear definition. Public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, communities, and individuals. That's a mouthful, so let's break it down. Science and art, this means public health relies on data, research, and evidence, but it also requires creativity and adaptation. Preventing disease, we try to stop problems before they start. Prolonging life, we aim to reduce premature deaths. Promoting health, we don't just treat illness, we try to make people's lives healthier overall. Organized efforts, this isn't just one person's job, it's a coordinated system involving governments, NGOs, schools, businesses, and citizens. Think of public health as the behind-the-scenes force that shapes the conditions in which we live, from clean air to safe roads to nutrition guidelines. When it works well, it's almost invisible. We don't usually think about the diseases we don't get, or the disasters that don't happen, because public health made sure of it. 3. Historical perspectives. Public health may seem like a modern concept, but its roots stretch back thousands of years. Let's take a quick historical walk. Ancient civilizations. In ancient Egypt, records show public drainage systems and early medical records. The Indus Valley civilization had surprisingly sophisticated sanitation systems, with toilets connected to covered drains. The Romans were champions of public works, aqueducts for clean water, public baths, and sewers like the Cloaca Maxima in Rome. They understood that clean water and waste removal were vital for public well-being, even if they didn't fully grasp germ theory. Middle Ages. This era saw devastating outbreaks like the Black Death, which killed millions. While medical knowledge was limited, some cities began quarantine measures, a concept still used today for infectious disease control. 19th century advances. This period was a turning point. With the Industrial Revolution came overcrowded cities, poor sanitation, and disease outbreaks. Figures like John Snow, who traced a cholera outbreak in London to a contaminated water pump, show the power of data and investigation. Around this time, Louis Pasteur and Robert Koch advanced germ theory, transforming medicine and public health forever. 20th and 21st centuries. Vaccines, antibiotics, public sanitation, seatbelt laws, anti-smoking campaigns, these and many other advances have saved millions of lives. Today, public health faces complex challenges like climate change, antibiotic resistance, and global pandemics, requiring a mix of traditional methods and innovative approaches. 4. Core concepts in public health. Public health rests on several core ideas. Prevention over cure. It's cheaper, more humane, and more effective to prevent a disease than to treat it after it happens. Population focus. Public health deals with entire communities, not just individuals. Equity and fairness. Everyone should have the same chance at health, regardless of income, race, or where they live. Interdisciplinary approach. Public health draws from medicine, sociology, economics, environmental science, law, and more. Evidence-based practice. Decisions should be based on data and proven results, not guesswork. 5. Tools for problem solving. Public health problems can be tricky, They often involve many causes and require solutions that cross boundaries. Some of the main tools we use are epidemiology, the science of studying patterns, causes, and effects of health and disease conditions in populations. Biostatistics, the numbers side of public health, used to interpret data and make sense of trends. Health policy and management, crafting laws, regulations, and systems to protect public health. Environmental health science, understanding how air, water, food, and surroundings affect health. Behavioral and social sciences, studying how human behavior impacts health and how to encourage positive change. 6. Data and measurement in public health. You've probably heard the phrase, what gets measured gets managed. In public health, measurement is crucial. We collect and analyze data to answer questions like: how many new cases of a disease occur each year? Incidence. How many people currently have it? Prevalence. How many people die from it? Mortality rate. How many years of healthy life are lost? Dailies and Kayleys. Without good data, public health becomes guesswork, and guesswork can cost lives.